Hi everyone, thanks so much for joining me today. My name is Gabby Berger, and I'm the director for the Clinician Educator Pathway at the University of Washington Internal Medicine Residency Program. I'm delighted to give you an overview of the pathway and highlight the unique learning opportunities it presents. I'll start by sharing the goals of the pathway, how the pathway is structured, and a bit about the in-depth training and teaching experiences we offer our residents. The Clinician Educator Pathway is a specialized learning opportunity for residents in the R2 and R3 years. Our goals for the pathway residents are to build skills as educators and explore careers in medical education. To build skills, pathway residents have protected time to participate in small group teaching where they create a safe space for learning and deliberate practice and develop new curricular content and teaching materials with feedback from their colleagues. Our residents have unique opportunities to teach both novice and senior students in the classroom and in the clinical setting, as well as their peers in the residency program. Finally, pathway residents are paired with seasoned clinician educators in the UW system who serve as mentors and coaches to help grow their teaching skills. These are just some examples of the domains we highlight in our small group workshops in the pathway, with a focus on how our residents can become effective teachers and role models. Our second major goal is to help residents explore and prepare for careers in medical education. By exposing our residents to clinician educators working in different spaces throughout UW Medicine, residents develop a richer understanding of the varied career paths open to them. All residents graduate from the pathway with a teaching portfolio, engage in medical education scholarship with a faculty mentor, and partner with faculty mentors for career guidance. The Clinician Educator Pathway is built on 3 core pillars, including a month-long immersion block in the R2 and R3 years with dedicated time for workshops and curriculum development, a set of longitudinal teaching experiences that allows residents to develop relationships with students over 2 years in the pathway, and an expectation for scholarship on a topic in medical education they're excited about. Some residents complete individual scholarly projects, and some pair up to implement larger curricular innovations. Recent ClinEd Pathway projects have been presented at national conferences, including the Society for General Internal Medicine and the Association for Program Directors in Internal Medicine, and have been published in MedEd Portal, the Journal of General Internal Medicine, Medical Education, and others. Residents in the pathway build a smaller home or community within our residency with a diverse group of colleagues who share a common set of interests. Interns apply for the pathway in the winter of intern year. Teaching experiences begin in the fall of R2 year, and the bulk of scholarly work takes place in the spring of R2 year and throughout the R3 year. While second-year residents engage in structured didactics during their immersion block, third-year residents help teach in the pathway, receive training for our near-peer coaching program, and take a leadership role in teaching clinical reasoning to our early medical students. The longitudinal teaching experiences with students are often the highlight of the pathway. Our residents are paired with an experienced faculty member in the School of Medicine to teach clinical skills to first and second-year medical students. These sessions focus on how to elicit a patient-centered history, perform a trauma-informed physical exam, and use the data collected to develop a robust differential diagnosis. Residents also precept fourth-year students in a special primary care clinic at Harborview with mentorship and oversight from Renata Thronson, our APD for Educational Strategies. As you can see, mentorship forms the foundation of everything we do in the Clinician Educator Pathway. Most importantly, mentorship in the pathway is multidirectional. Pathway residents are mentored by the pathway director, their project mentors, and their UW School of Medicine paired faculty mentor for clinical teaching. Residents provide peer coaching for their junior colleagues on the wards and develop near-peer mentoring relationships with their medical students. Every year, we have 12 pathway residents in total, 6 R2s and 6 R3s. Our pathway has been in existence since 2011. But to keep it simple, here is a sample of what our pathway residents have gone on to do after finishing residency at the University of Washington in the last 4 years. In summary, the Clinician Educator Pathway at the University of Washington is a unique opportunity for you to explore your passion for teaching, mentorship, and careers in medical education. Our graduates move on to teaching roles in primary care, hospital medicine, and subspecialty practice. They are practicing in the Pacific Northwest and throughout the country and are always sought after teachers in their institutions. The Clinician Educator Pathway serves as an incubator for future leaders in medical education. If this sounds exciting, you're right, and you should contact me. Thank you so much for spending a few minutes with me today. We believe our Clinician Educator Pathway provides an unparalleled set of experiences for residents interested in this career. If your passion for medical education is ignited by this conversation, then we should talk more. Please feel free to reach out. I look forward to hearing from you.